and substantia nigra. No, I would no. And here, other. Yes, and now you see there are half of the brain areas are affected by environmental toxins. Yes, and then when the hypophysis, that is the main gland for all the other glands of the body.
Yeah.
And therefore you must treat him at first hypophysis. There is no more burden. Thank you. Any other question?
Following, what is treatment remedy? Yeah. Remedy for the treatment.
For the treatment, yes, that is here. That is moral. You remember.
There is 77.
Yes, 77. Environmental toxins and viruses and allergies. IgE allergies. Not histamine. Then you must treat the intestines and so on. IgE, when you can, here only one test. IgE. Yeah. IgE, yeah. Here.
No, this one.
Ja. Hier IgE. Ne, lass mal. Ja. No IgE, no genuine allergies. He's not suffering from, and therefore the other one, histamine. Yeah, histamine. Yeah, that doesn't matter. Yeah. Yes, and now 10 times more, and then between 1,000 and 10,000, but there is a high burden of histamine, and we must go on testing him. And yes, but I wanted to show you how to find the best remedy for his problem, for the spinal cord, and that was a good suggestion. Generally, it is sufficient when you do it against amoeba. But when you have a greater problem, you must do it here. We test the spinal cord, and all the positive tested one we put in a honeycomb, and instead of amoeba, we have the parts of the spinal cord, instead of amoeba. And then we test the remedies against the sections of the spinal cord, and not against amoeba, and that is more exact. That's more exact here. And sometimes this and sometimes the other one, and it depends on the time we have. That is much more time to test. But yes, thank you very much.
Thank you.
You know this acetylcysteine, that is a remedy for the lungs, an expectorants, you know, and that is cysteine. And cysteine is a part of Glutathione. Hier, du kannst mal einen anderen nehmen, hier in der Mitte Selen, hier, und hier machen wir einmal Cysteine und hier Glutamin. In der Mitte Selen, ja. Und dann, ist so gut. Ja, ist egal. Dann hier oben, hier runter, links, Cysteine. CY, Cysteine. I will tell you, glutathione, that is the central substance, the central compound to fight against cancer. And then the other one is glutamine, yeah? Glutamin. T. noch besser, Glutamin. So, und hier oben, du kannst ruhig darüber machen, Glycin. 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 Nein, vorher noch, muss ein GL, Glycin. And that is glutathione. Ne? Glutathione. Yeah? Yes. And you see, glutamine, I mentioned several times, the glutamine for the mucous membranes and so on. And it is for the glutathione too. But you see, they are omnipotent here, glutamine and cysteine. It doesn't cost anything, and you can give him 2 times half a tablet of ACC 600, 2 times half a tablet. Yes, you understand? Yeah, it is not so difficult. And yes, and therefore we order only selenium and sometimes ACC2. And glutamine, that is, for the mucous membrane, and glycine, normally there is no problem of cysteine. Yes. Yes, breast cancer in Germany, and here you have early detection and late detection. And now we have the tool to check in an early detection with more. We can do it. You remember the former start here, and we can avoid more than 80%. That is conventional medicine. Early detection 80%, late detection only. The survival is only 20%. Intestinal, here 85%. And with MORA, we can check before. We can check the polyps and so on in the colon and so on. And once more, with MORA you can check tendencies to tumors, not the tumor, because before, and then you can intervene. That's no problem. Here, and before starting the therapy, chemo or radio, check lactobacillus, check glutamine. Here you have it again, and then the vitamin B5. It is for the mucous membranes. B6 is for the transfer of all the hormones. Vitamin E, selenium, and so on. And here, no deficit of anti-inflammatory omega-3. And therefore, because before they start the chemotherapy, we prescribe omega-3 every time against micro-inflammation. And here, you know that. Is Candida present, Clostridia present, and so on. And yes, now daily intake, here, it is rather difficult to to see that, but here's the mouse. It's terrible. It's terrible. By chemotherapy. Now here ulcer, big ulcers, and here's the mouse full. Don't forget glutamine. Why don't they prescribe glutamine? It doesn't cost anything. Only some euros or and yes. And how we treat the oral mucositis? And then perhaps we do it at the end of our lecture this evening, how to differentiate between the active phase and the dormant or the inactive phase. That's the same. Now, we can do it with water. Because don't apply chemotherapy when the tumor is in an inactive phase. You will only harm or damage the immune system and not the tumor. Not the tumor. That is the problem. And yes, here active, how we can differentiate. When there is a high portion of acidum lacticum, then the tumor is in an active phase. But you will remember me this afternoon that I will explain it. It is better in a later. Here AMS, you have to test AMS here again and acidum lacticum, but at the moment, no bad carbohydrates. Why? Why? I will explain it later on. Here environmental toxin we measured here here within environmental toxin. And concerning with women, it is a special problem because of the estrogen property of the environmental toxin. So he must undergo here the elimination of the environmental toxin. No? Why are the environmental toxins here? Here is the answer. And when there is an affection of the hypophysis, as with you, hypophysis, then you will have perhaps a polyendocrinopathy. Because here is a dominant gland, the hypophysis, for all the other glands in our body. And then the result will be a polyendocrinopathy.
For the woman, if they have the high environmental toxins, they will have the estrogen effect. Right?
Yes,
and
yes.
they will cause troubles on female genital organs.
Yes.
Right? But how about for men? That
Yes,
will
yes,
the
that
same
with
happen
men,
to
with men,
prostate?
yes, we thank God, men had not so much trouble, environmental toxin and cancer. I didn't find men who had a high burden of environmental toxin and cancer. I didn't find a relationship between the burden of environmental toxin and cancer. But with women, you must do it. You must eliminate the environmental toxins. Yes, because you have three factors of estrogen effect, body on and environmental, and because estrogens high, cancer high. That is and fat tissue is an estrogen producing tissue. In every fat tissue, hormones are produced. But it is not a problem of Taiwan and in Asia, but in Germany and all over Europe and in the States, especially in the States. Here, fat tissue. And here, once more, here, the 45% of the reproductive organs, I told it sometimes more than 40%, they cancer by the reproductive organs, here, female. The cancer problem number one is a race against time. We must do something. We must do something. And estradiol, that's the problem, the malicious hormone. And once more, I must underline it again and again, estrogen is an endogenous carcinogen. Again and again. And then here, most effective, the message, again, grow, 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 grow. And here again, the estrogen dominant. You have a little deficiency of estrogen, but a high deficiency of progesterone. Nevertheless, we call it an ED dominance. That means estrogen dominance. Here you have a little deficiency, but a high deficiency of progesterone. And when you go to your doctor, and he will not measure progesterone. He will not. He does not. Why? Because it is so important. But there is a deficiency of estradiol, and you have some symptoms of lacking estradiol, and he will prescribe you estradiol hormones. And then the difference even higher. And then you have here and here down to 250. Never use estradiol. Never. We have so many possibilities to fight against the menopause symptoms. Menopause symptoms with Wala, for example. And yeah, more than 40%. Why? Yes. Here, that was about 1960 or 1965. There was the effect of chemistry. Before we had no chemistry. Here, everywhere we have chemistry all over the world. And therefore, the level of estrogens, cancer high. And then the hormone replacement therapy. At the beginning 1960 and so on, only estradiol replacement. Only estradiol. And then here, cancer. There was another leap. And hormone disbalance itself by irregular ovulation. And why? When there is no ovulation, then you have no progesterone. That's problem. And many in Germany, in Europe, many women suffer from non-ovulatory cycles. Non-ovulatory cycles. And therefore, they are suffering from estrogen deficiency. That is the reason for that. And yes, Conrad, that was the book. I remember the book. Forever Young, here, 1900, Forever Young. Yes, that was a book released in the United States, but only estrogen and forever young. Yes, because they died at the age of 30. Forever young. That is sarcasm. Sarcasm. Thousands of women were driven to death by the estrogen constitution. Forever young. And cause 7 years. The Silent Spring. I remember the book. Too. The Silent Spring. The same year. Was the same year that yeah, all over the total chemistry that animals, that birds, for example, they the male birds, they set on the eggs, and normally it is the female birds, and so on. And the alligators in Florida, they were infertile because of the estrogens, infertile, and so on, and so on. And here that is hormone replacement therapy. It is well known, and that is evidence that the hormone replacement therapy does a lot of harm. And yeah, estrogen is everywhere. Drinking water, you see, the women, they take the pill, and it cannot be filtered away in the water. And so everybody drinking water, there's a pill for everybody. The pill for everybody. We all swim in a lake of estrogens. And here estrogen active, and so on. Result, that is the result. Creeping feminization with men. That we fear that in the States, 50% of the male people will be infertile in 2000, but it is not a great increase of cancer of the testicles. Yes, that is because of the feminization. And here, and you must keep in mind these two. That is nonylphenol and bisphenol A. They have the highest estrogen effect, these two. And in every can, there's a lining in it. And the lining, that is bisphenol A. In every can you have. And it must be in Europe. And then there is a feminization, that is an estrogen effect. Here, estrogen only, substitution only, severe indication, and here you have alternatives to avoid or reduce the symptoms of menopause. Menopause here. And here, that's it. Ovarium compositum, placenta compositum, heal, but they have similar ones from Vala. And never substitute estradiol. Never when they have their monthly cycle. Why? Because the menstruation is exactly the evidence that they have enough estradiol. They have enough estradiol when there is a menstruation. That is the evidence for it. Don't do that. And here, estrogen, what is the effect? Cell proliferation goes on, is induced, and then cancer will arise. And here, progesterone, cell differentiation, and when there's a cell differentiation, the apoptosis is activated and cancer down. Now, every cell which has a tendency to become a cancer cell, there is the best remedy, the apoptosis. That the cell, this individual cell will die. And progesterone activates gene P53, and that is apoptosis. It is here, this gene is responsible for the apoptosis. And estradiol non-opposed, while progesterone is the most frequent cause of mama, uterus, and ovary cancer. Yes, and I think we have the here now we have the but it is methionine, cysteine, these are, and we have a lot of them. Yes, but you must keep in mind methionine and cysteine. Cysteine part of glutathione, as you know. Yes, sulfur, and therefore, which compound of selenium you choose? The organic selenium or the unorganic selenium?
Unorganic. Inorganic.
Inorganic.
Yeah.